Thank you so much for joining us. Welcome to Building Stability for Youth, Integrating Diligent Recruitment and Adoption Competent Mental Health Services. My name is Margarita Hughes. I'm a National Child Welfare Advisor with Raise the Future, representing the National Center for Diligent Recruitment. And I am joined by my good friend and colleague, Erin Bader, Director of Knowledge and Dissemination for the National Center for Adoption Competent Mental Health Services. Next slide, please. Just some general housekeeping that we have for you all. Please note that this webinar will be recorded and shared with you. Please feel free to submit your questions via the chat. This can occur throughout the presentation. We will be collecting those questions so that we can answer them in the latter portion of the presentation during the question section. And you will all be receiving a survey at the end of the webinar. We encourage you to please take that survey so that we can review those results and continue to bring you some great content. Next slide, please. I want to start off just by reviewing the goals of the National Center for Diligent Recruitment. Those goals include to increase the capacity of states, tribes, and territories to collect data to guide focused recruitment. In addition, to provide on-site technical assistance to support diligent recruitment planning, and to identify, document, and disseminate evidence-informed methods and approaches that strengthen systems and can be replicated. Next slide. So again, I want to welcome you all and thank you for joining us today. Now, regarding our objectives, we know that youth in foster care often have a wide range of complex unmet needs, whether they be educational, medical, relational, and more. And each of these areas is critical to the well-being and long-term success. However, for today's discussion, we're going to focus specifically on mental health needs. And why? Because mental health is foundational. When these needs go unaddressed, it impacts placement stability, caregiver confidence, and ultimately our permanency outcomes. So our goal in this webinar is to explore strategies and partnerships that ensure families and youth have access to adoption-competent mental health supports as part of diligent recruitment planning. Next slide, please. So first, we're going to look at the intersection of diligent recruitment and adoption-competent mental health services. Next slide. So just moments ago, I talked about the goals of the National Center for Diligent Recruitment. Now, diligent recruitment is built upon 8 key concepts, and one of those is family support, making sure our adoptive, foster, and kinship families have what they need to thrive. And what's really interesting is the synergy between what we do and what adoption-competent mental health services provide. Now, both of us share the same focus, and that's preparing families, sustaining them, and supporting them over time. Now, when families have access to these specialized mental health services, we're not just helping them feel prepared. We are giving them the tools and support they need to stay engaged and continue caring for children. And that's ultimately what helps us to retain the caregivers and provide stability for children. Next slide. So why adoption competent mental health support matters for diligent recruitment. Now, in the chat, I want you all to provide some examples of support gaps that some of your families mention most often. So take a minute, provide that in the chat, please. We see respite, lots of respite. Daycare, therapy. Yeah, those are great. Thank you. Let's go on to the next slide, please. So let's start by looking at some high-level trends that we're seeing across child welfare. Across the country, agencies are reporting that families are declining to foster or adopt because they perceive a lack of support. They're asking, will I have the help that I need? Now, we also know that placement instability, it often stems from unaddressed behavioral and mental health needs. And when those needs aren't met, families feel overwhelmed And children experience multiple moves. And for youth with complex needs, this gap in preparation and support means they remain in care longer because caregivers don't feel equipped to meet those challenges. Next slide, please. So what does this tell us? It tells us recruitment isn't just about finding families. It's about building confidence that they won't be doing this alone. Mental health support is a powerful recruitment message. When we can say to families, you'll have access to adoption-competent mental health services, it changes the whole conversation. Support pathways make families more willing to say yes. They know there's a plan for when challenges arise. And this just isn't reassurance, it's a strategy for retention. Because when families feel supported, they're more likely to stay engaged and provide stability for children. But how do we make this real? Now, one tool we encourage as part of diligent recruitment planning is service mapping. Now, service mapping means identifying what supports already exist in your community and then identifying where those gaps are. So we want you to ask questions like, do we have providers trained in adoption competent mental health? Are services accessible geographically and financially? How quickly can families get help when they need it? And when we're mapping services, we can integrate that information into our recruitment messaging. So instead of saying, we hope you'll have support, we can confidently say, here's what's available and here's how you'll access it. That level of transparency builds trust and it helps families feel prepared. So the connection is clear. Recruitment challenges often reflect gaps in service access. And by addressing those gaps and making mental health support part of the recruitment conversation, we not only bring more families to the table, but we help them to stay. And that's what creates stability and permanency for children. Next slide. So let's look at integrating adoption competent supports into our diligent recruitment plans. Next slide. Recruitment is so much stronger when families feel confident that they'll have access to the mental health support they and the youth need. We know that families are more likely to say yes when they trust that support is available, and that starts with how we plan, message, and deliver our services. So let's start with messaging. Recruitment messaging should normalize the need for support. Instead of presenting support as something only for families in crisis, we frame it as all families need support and support exists. So at recruitment events, highlight access to adoption competent providers. Share concrete examples, such as, here's how families can connect with trauma-informed therapists, or here's what ongoing support looks like. This transparency, again, it builds confidence and it helps families feel prepared before they even start the process. Next, our licensing and pre-service preparation. This is where we really set the tone for realistic expectations. Integrate content on trauma, grief and loss, and attachment into your orientations. These topics help families understand the emotional landscape of fostering and adoption. And then pair those conversations with consistent support pathways. For example, if you encounter challenges with attachment, here's a specialist you can call. When families know what to expect and how to access help, they're more likely to stay engaged and again, provide that stability. Next slide. Data is another powerful tool. Use disruption data, service waitlist data, and youth needs data to define your recruitment targets. If disruptions are linked to unaddressed mental health needs, that's a signal to strengthen support messaging. Also look for provider availability. If families are waiting months for services, that gap influences placement stability. Recruitment planning should include strategies to address these gaps, whether through partnerships, telehealth, or specialized training for local providers. Now, our kinship caregivers will often face barriers to accessing mental health supports, so make sure they have access to adoption competent services. Those geographic barriers are another challenge, And telehealth can be a real game changer for our families living in rural areas. Tailored supports like mobile therapy units or virtual support groups can ensure that no family feels isolated because of where they live. Now, recruitment isn't just about finding families, it's about building confidence that they'll have the mental health support they need. And by embedding these strategies into diligent recruitment plans through messaging, preparation, data, and ensuring access, we create a system where families feel prepared, supported, and committed. And that's what leads to stability and permanency for children. Next slide. Now, when we talk about strengthening diligent recruitment efforts, one of the most powerful resources available to jurisdictions is national technical assistance. And today I want to highlight how two centers like the National Center for Diligent Recruitment and the National Center for Adoption Competent Mental Health Services can work together to provide that complementary support. Next slide. So building stronger systems for families and youth. Recruiting families is only the first step. Helping them succeed requires ongoing support. Now, two national centers support one another in building stronger systems for families and youth to make this happen. Our National Center for Diligent Recruitment helps states and agencies design recruitment strategies that do more than bring families in. They work with jurisdictions to understand the importance and value of connecting families to the services and supports they need. Now, this includes helping to support clear pathways so caregivers know where to turn when challenges do arise. It means supporting messaging that sets expectations, especially for families caring for youth with complex needs, making mental health support part of that plan. It means linking recruitment to system improvements so families aren't just recruited, they're sustained. Now, the National Center for Adoption Competent Mental Health Services strengthens these efforts by training and developing providers who understand adoption and permanency needs, and offering practical tools that give families confidence to say yes and stay committed. Now, the big picture. Jurisdictions don't have to choose between these resources. Using both together creates a comprehensive approach where recruitment and mental health services work hand in hand. And this builds a stronger, more sustainable system for our families and our youth. Now that we've looked at how adoption competent services can enhance diligent recruitment, let's turn it over to the National Center for Adoption Competent Mental Health Services to take us deeper into what adoption competent practice looks like, how providers are trained, and how jurisdictions can access these supports. Next slide, please.
Thank you.
Yes, our medical and behavioral needs are increasing, but one of the most pervasive needs we're seeing is around mental health. And as I said, one of our sister centers is here to discuss how systems can enhance their competencies around mental health and to provide this increased level of service and support to our children, youth, and families. So without further ado, I will hand it over to Erin Bader. Thank you, Erin.
Thank you, Margarita. Wow, that was an excellent setup. I couldn't have done it better myself. Good afternoon, everybody. My name is Erin, and I am, as the title slide said, the Director of Knowledge and Dissemination for the National Center for Adoption Competent Mental Health. And you may know, but in their infinite wisdom, the Children's Bureau funded 3 of these national centers, obviously this Center for Diligent Recruitment, my center, and then the Center for Enhanced Post-Adoption. And as Margarita said, there is a lot of great knowledge, information, and services available to all of you through these 3 national centers. So I'm happy to be here to share a little bit more about the National Center for Adoption Competent Mental Health Services, but then we're really going to get into what we are doing to try to be part of the solution to this very large problem. And I saw it through the chat. So many of you said that the common issue is inability to access mental health services, adoption competent mental health services. And unfortunately, I'm not surprised to see that. So I'm going to start by just doing a very brief introduction about the National Center for Adoption Competent Mental Health. So we were funded in 2023 through the Children's Bureau, and we were actually the first Children's Bureau funded collaborative effort. So between child welfare and mental health. So obviously the Children's Bureau is the federal child welfare arm, but we were tasked with bringing both the child welfare system and mental health system to the table in order to do our intensive technical assistance work. So through everything that we do, we kind of are guided by some core goals, building provider capacity, improving access to services, supporting families and caregivers, integrating mental health into permanency planning, well timed for this webinar, and then promoting sustainability. So, we can only be within a state, tribe, or territory for, 18 or so months. So we want to start planning for sustainability from the very beginning. Next slide. So in that video, you saw or heard from two folks from Oklahoma. Oklahoma was our first site for intensive technical assistance. So that's why we were able to kind of feature what their experience was. But Dr. Goodwin specifically said something I wanted to highlight, that we leverage the work that states, tribes, and territories are already doing. I know that every system around the country is overwhelmed, understaffed, dealing with very complex challenges. And so we don't want to come in and be just another thing. We really want to come in as a support and a mechanism by which to continue to enhance the cross-system collaboration, enhancing adoption competency of the workforce in both child welfare and mental health, as well as starting to address or help address some of those barriers to accessing mental health services that families are experiencing. So there's a lot of commonality there, and we'll get into that here in a little bit. Next slide. Oh, so our goals are just one by one coming up, and I just went through those. So and I'll kind of go into a little bit more detail in some of these upcoming slides. So we are guided by our North Star. And basically, our North Star is that we want children to thrive and to live in states that sustain systems that are adoption competent and responsive to the needs of children and families. And the most important part is that children and families can access those services, especially within their communities and without having to go through the child welfare system. Next slide, please. So I like this graphic because it really kind of captures the essence of what we're doing. We're using cross-system collaboration. We're building these relationships in order to enhance the adoption competency across these child serving systems, and then start to address the barriers in accessibility for adoption competent mental health services. So the goal of this multi-system participation is shared language. And so one of the tools we use, and I'll talk about this in a minute, is the NTI and TAC training. So allowing professionals to take those trainings, give them all kind of the shared language and understanding of the needs of the children and families that they're working with, and gives them the skills to kind of work better together and streamline the services that are available to families. So when I say cross-system collaboration, who do you think, so I've already kind of said child welfare and mental health, who else do you think should be at the table? Who do you think we're working with when we're going to states, tribes, and territories? Legal, absolutely. Yes, doctors, medical, judges. Yep, school. School is a really important one, right? Because that's where our kids are for how many hours in a day. Yes, perfect. You're exactly right. And we actually, you may know, but there is a training, an NTI training, a curriculum specifically for school professionals, in addition to the one for child welfare and mental health. Next slide. So many of you probably already know this, but I thought that I would just kind of ground us all in the shared understanding of what adoption competence is. And before I talk about this, I feel like we've learned in the 2 years of doing this work, it's most important to say that even though adoption is in the name, adoption competence, the practice, the adaptation, the way of doing our day-to-day business applies across the child welfare continuum. So I try to encourage folks to not get too hung up on that adoption word, because really we know that these services benefit any child or family who's experienced the child welfare system, because there's a lot of shared experiences and challenges that go with that. So simply put, adoption competence is a necessary adaptation to how we support children and families within the child welfare system. We have very competent providers in our field who do great work. We're talking about training them and giving them the skills that they need to better understand and to meet the needs of children and families who have come into contact with the child welfare system. So through adoption competence, we help professionals understand that behaviors are survival responses, fear responses, trauma activation, or attachment injuries. Treatment focuses on healing relationships. That's number one. The sessions are conducted with the entire family. So it's not one of those where the parents drop off the child and then come back and find out how the session went. The work is being done within those relationships, strengthening the attachment between the parents and the child, between the child and the siblings and extended family, and also providing support to the caregivers because they are the therapeutic agent. And parents are a partner in the therapeutic process. Next slide. So I wanted to show this roadmap. It kind of captures that when we're talking about workforce development and the development of adoption competency, it is a journey. This is a roadmap, but you will see that we intentionally do not have a beginning or an end point, and there is no one set path to developing adoption competency. And I think the main takeaway is that this is ongoing. So you can't just say, I took the NTI training and now I'm done. I'm adoption competent. I don't need to do anything else, right? You can see that there's multi-steps along the way and that the learning will always continue because the ultimate goal is to be responsive to the needs of children and families. And obviously those change as years go by. So I wanted to also use this to highlight the Center for Adoption Support and Education, CASE, which is my organization, has been working on adoption competency for 25 plus years. And the most important piece of this is that it was created by families who had adopted in response to the needs, the unmet needs, even back then, of families being unable to find mental health providers. Many of you are probably familiar with NTI. That is another project funded through the Children's Bureau. Who has taken NTI, either for child welfare, mental health, or the school-based? Can you let me know in the chat? I'm just curious. And then we also have the training for adoption competency, which is specifically for mental health professionals. And it's a longer program and it's cohort-based as opposed to solely online. And then you can see the National Center and how we fit in. And then if you haven't heard, there's also the CASE Academy. That's the piece where the ongoing learning can happen, where professionals who maybe have taken NTI or taken TAC can then continue to meet with, their peers and attend ongoing sessions, webinars, hear from experts to continue development of their competencies. Next slide. I want to quickly show this. You could look and see if your state is in color, whether it's green or blue or has the stripes. These all are indicated of the states are participating in one of those programs or many of those programs. And if you're interested in talking, I think the most important piece is what Margarita said earlier, is that you don't have to choose. These services are available to you, and this is why the Children's Bureau has funded, and we're all here to support you and to leverage the work that you're already doing. Next slide, please. Okay, so now we're going to apply an adoption competence lens. I'm going to get a little bit more concrete to common experiences and some behavioral manifestations that I'm sure we've all seen from the children that we've worked with. So first of all, Ambiguous loss, I'm sure many or most of you know, is a type of grief without closure or certainty. It was coined by Pauline Boss in the 70s, I think. And this is what a lot of our children are experiencing. And it is important to allow them. And you heard, I think it was Tony in the video say, it was the first time that he was given permission to talk about and to address the loss that was pervasive through everything that he had experienced. And when we aren't giving them that permission and allowing them the time to process their story and the grief and loss that they have experienced, we sometimes start to see some of these behaviors. Do any of these stand out to you? I'm sure maybe many of us have seen all or most of these. But what I wanted to say is that these aren't defiance. It's not misbehaving. It's not being difficult for the sake of being difficult. They're often responses, as I had said earlier, to grief. It's a reactivation of their trauma. It's usually an expression of an unmet need of some kind. So we have to look beyond the behavior, and adoption competence helps us to do that. Many children are grieving losses that are unclear, complex, or never fully explained. And this is what we mean by ambiguous loss. Because these signs can be easily misinterpreted, clinicians and caregivers, excuse me, may respond in ways that don't address the root causes. That's why adoption competent practice is so essential. It helps us to understand correctly what we're seeing and then respond in a helpful manner. Next slide, please. So we know that our kids have and families have unique needs that require an additional, I should say, training for both child welfare, mental health, and school-based professionals. So why should any system consider adoption competence training and integrating it within their curriculums that already exist? So first, I have another question for you all. What core training are staff in your systems going through? I know there's a handful of kind of that are used in many different states, and some states have their own personally developed curriculum. So I'm just curious to hear from you all. And as you're reflecting on that, let's think about your system that you work in, that you interact with within your local area. So consider whether your current mental health outcomes for children and families are exactly where you want them to be. Reflect on whether the systems are paying for high cost, high levels of care without seeing positive returns, or are kids having to be placed out of state because of higher levels of care. Ask yourself whether the services you're providing or the funding you're offering are producing meaningful results for families. And think about, when I asked you to think about the core training, does it prepare professionals, both child welfare and mental health, that's kind of who we're focused on, does it prepare them adequately to address attachment, grief, identity, and behavioral needs effectively? What do you think? Do your trainings cover those topics well? Okay. Oh, NTDC, another Children's Bureau funded one. NTI, bonus points. Just kidding. Okay, next slide. So here's some of those topics. Are your staff, are you or your staff, your colleagues, any child caring professional, are they receiving training in these core areas? I think what's great about adoption competent training is that it takes all of these and puts it into one training. So I think many of us have received training, maybe multiple trainings on some of these topics, but adoption competence is comprehensive, and it not only puts all of these concepts together, but it helps to apply it directly to the children and families that we're working with. Out of all of these, what training, is there one of these topics that you think you or your systems need the most, need more information or more training and education on. That's my director of knowledge hat coming through. I'm always curious to hear from folks about what the information needs are. Behaviors. Oh, therapeutic parenting. Yes. Oh, do well with training for resource families and post-permanency. Oh, yes. Schools, mental health, medical professionals. Thank you. Oh, now it's moving so fast. Okay, next slide. And full transparency, I was realizing as I was watching my video that I've repeated the data points that were in the video. So we'll just quickly peruse these because maybe they went too fast in the video and you didn't catch all of them. This top one, I think it may not be a surprise to some of you, but not more than 90% of children in child welfare have experienced multiple adverse childhood experiences. So those are the ACEs. And we know the impact when you've had more than one ACE and the impact, the long-term impact it has on development. We also know that up to 80% of children in foster care have significant mental health issues, and only half of children who need mental health treatment receive it. And that's where we come in, right? Next slide. And you saw some of these in the video. These are more general to like the overall mental health crisis in the United States. So we're kind of contending with both, right? There's a nationwide shortage of mental health providers, period. And then you talk about providers who are specifically trained to meet the needs of our children and families. That's an even smaller number. And so that is where we are coming in as the National Center to try to work with states, tribes, and territories to address some of these access issues. Next slide. So how are we going to do that? Well, we're trying a few different things, but I will say, of course, that for every site that we work with, it's catered to the needs of that particular site. So we try to be innovative and responsive to those unique needs, but we do have some tricks and some tools in our toolbox. The first one obviously is training of professionals, and I've talked about our tools that we use, NTI and TAC and the Academy. We need providers who are specifically trained to understand the needs of children and families in the child welfare and adoption constellation. But then it's not enough to train those professionals. Referring professionals, so folks that work in child welfare, need to also know which providers are adoption competent. Well, actually, they need to recognize that they should be referring to someone who's adoption competent and then knowing how to make such referrals. But then also so that families, if they aren't connected to child welfare or are seeking services on their own, they need to be able to find those adoption competent therapists in their area as well. And that's where our national directory comes in. Anytime a professional completes NTI or TAC, they are able to be entered into the directory so that families can find them. And there's a link on one of the last slides, so you can visit that directory and see how many folks are trained within your area. So access also depends on the cross-system collaboration we've been talking about. Including insurance, obviously, and Medicaid and managed care. I think I saw that earlier in some of the comments. We know that the people that are paying for these services have to be at the table, have to recognize the need for this specialized service, and then be willing to pay a higher rate. So we're working on that. We've actually been able to bring some of these Medicaid managed care companies to the table in certain states. So telehealth, we're also trying to help states, tribes, and territories to look at, if they aren't already using telehealth, how do they get it started or how do they expand it? And then making sure that there's an awareness of and access to information and services where families are. So we've talked about this a little bit, right? The doctor's offices, the schools, the community mental health centers, family resource centers. We should have services available where families are. And improve their ability to access it easily and without having to go through a lot of hoops. And then we also need funding. We need policy to align, and we need to reduce the stigma, normalize the need for support. I think that was something Margarita said at the beginning. Every family needs support, specifically for the families who have experienced child welfare. They're going to need support, and it's likely to be on and off lifelong. It's a lifelong journey, and it's perfectly okay for them to need access to support. So we set them up from the very beginning, knowing that and helping them to understand how they'll be able to access the support when they need it. Next slide, please. Okay, so the connection between what I've just talked about and placement, caregiver retention and placement stability. So we know the kids and families involved with child welfare have unique needs. We've covered that part. We know there aren't enough mental health providers in general, but then even less of the child welfare adoption competent providers. And then families are needing to be able to access those services when they are available. All of those things influence permanency stability. So if we can increase recruitment and retention of homes by talking to them, as I just said, about the supports available that will be available for them at the beginning, in the middle, and whenever they would need it, even after, the case has been closed or their involvement has ended. Helping them understand that that's available will increase their confidence and their comfort that they will be able to respond to anything that might come up as their child moves about their developmental journey. Additionally, from a prevention mindset, if we are able to ensure that the services that families need are in the community and available to them, they're being paid for or approved by insurance or managed care, or they have a sliding scale, then families maybe don't need to even come into contact with the child welfare system in the first place. And if children are stable in their homes, then they will have less placement disruptions, which then minimizes or decreases the trauma that they experience, which also can contribute to more placements. So we want children to have access to the services that they need as soon as possible to further minimize some of those additional negative outcomes that could come. Next slide. Sorry, I need to drink a little bit of water. So I wanted to say on this slide, placement instability is not only a child and a caregiver issue, it's a child welfare issue. When placements disrupt, we know the impact it can have on the child welfare professionals and the system in general. So caseworkers absorb crisis escalation, emergency replacements, and court activity. Supervisors manage burnout, turnover, and reactive decision-making. Agencies lose experienced caregivers, increasing recruitment and training costs. And staff time shifts from permanency and prevention to crisis containment. So we need to have services that meet the needs of children and parents and strengthen the stability of those families. So what can we do? What's the solution? So adoption competence is a solution to this. It specifically addresses the challenges that children and families face. The challenges can include mood disorders, identity challenges, struggles with grief and loss, poor school performance, family conflict, on and on. Therapists understand the impact of all that the children and families have experienced before they came together, the history of loss and grief and complex trauma, but also the impact that those experiences have on a child's emotional, cognitive, and social development. So adoption competent therapists also collaborate with families to uncover the roots of the child's behaviors. So it's helping parents in real time kind of do that exploration with their child of what is really underneath that behavior and how do we meet the need that is being expressed. Therapists help families create supportive environments where youth can process their feelings and thrive, and provide parents the tools and confidence. Confidence, that's a key one right there, right? To address their child's needs with compassion and understanding. And for children and teens, it creates a safe space. We know that teenagers are exploring their identity and needing to integrate all aspects of their story. So this gives them a safe space to do that, to explore their feelings, to feel validated, and to feel understood. So research indicates that foster and adoptive families are significantly more likely to work with mental health professionals. We know that. So we need to ensure that they are working with mental health professionals that are helping, not unknowingly potentially causing harm or making things worse. Next slide. So adoption, this is a bold statement, but adoption competent services can help retain caregivers for just those reasons that I was just talking about. Research consistently shows that many foster and kinship caregivers begin their journey without the behavioral or mental health preparation needed to support the children that are placed with them, which contributes to stress and placement instability, a lack of confidence. Current recruitment tools focus on motivations and general readiness, but sometimes maybe don't assess for the mental health related competencies in our caregivers that strongly correlate with stable placements. But this is all teachable, and these are all things that can be incorporated. Caregivers don't need clinical backgrounds. They just need early support and ongoing readiness and access to information and learning. So we can integrate the learning. So a few of you mentioned NTDC. That's a great way to integrate the learning for our caregivers. We also have been working with some parent support partners in certain states and training them in NTI so that they can then turn around and provide support and education to other caregivers. And then we can also provide that parent peer support can also provide coaching in real time and help other parents and caregivers know what to do in some of these kind of crisis or escalated situations. So you can see that adoption competent services can help retain caregivers by doing all of these things. I think the most important one that stands out to me is it's strengthening the caregiver and the child relationship, because we know the healing happens within the context of relationships. Next slide, please. Okay, I'm looking at time. Okay, so what's really exciting about this is we recently in December, so this is kind of still hot off the press, released two new research reports about the effectiveness of specifically TAC, the training for adoption competency. But a lot of the findings can really speak to adoption competence and adoption competent mental health in general. And we know that 98% of clients rated services from the adoption competent TAC trained clinicians positively, compared to just 22.7 for the non-adoption competent trained providers. Families also attended 3 times more sessions, and 86% of them 86% of the clients receiving care from TAC trained clinicians reported meaningful improvement in child and family outcomes, which was 13 times higher than those working with non-TAC trained clinicians. So that's a pretty big deal. And I would say the client outcomes, I was just trying to find, so the positive outcomes that they reported was a reduction in emotional challenges, a greater therapeutic alliance, higher levels of engagement, and then positive outcomes in kind of how their family functions, communicative openness, adoption knowledge, relationships, parenting skills, and then their child's daily functioning and relationships. So good news. We know that adoption competence works and that it can help meet the needs of children and families. And so now we just need to increase the trained providers available across the country, and then start to address some of these systemic barriers so that families can access the services from those professionals that we have trained. So next slide, please. I just wanted to close out with this quote. So one of the reports that was released in December was a survey of adoptive families and about their experiences, both from receiving adoption competent mental health services, but also from those who did not. And you can see this person was talking about the positive experience that they had. And it was defined by deep empathy, adoption-informed knowledge, intergenerational insight, and empowerment. They met me where I was, embraced, this is the best part, embraced the complexity of my story. These qualities are not just helpful, they are essential. Okay, I think I'm going to hand it back to Margarita for questions.
Yes, thank you so much, Erin. So we had some questions roll into the chat. Because it was asked a couple of times, I'll just answer mine real quick. Will the slides be available to view at a later date? And yes, absolutely. Those will be shared with our participants. So rest assured, you can come back and review this information. In addition to watching the recording that will also be available to you. So here's the fun part, Erin. Here we go.
Okay.
First question is, are these services accessible across states, or does each specific state have their own set of adoption competent therapists with the National Center?
Yeah, so our goal is to get trained or therapists trained, child welfare professionals trained that are local to that city, county, state, right? So Oklahoma being our first site. We got, I think it was 100 or some trained within like a short time period. Like we try to kind of start with a smaller cohort and then expand for there. And when we're planning for sustainability, we want to build in NTI into that existing system within that state so that when we leave, they can continue training folks. So look in the great place to start is look in the directory and see if your state has people that are trained. If they do, that's great. If they don't, that's okay too. It's just then a matter of increasing the awareness of the need for this training and then getting folks trained. And NTI is free and it's web-based, so it's really easy to sell to folks that they can kind of do it self-paced.
Amazing. Perfect segue into the next question about finding, identifying adoption competent therapists. It was said, I don't think there's a label for that when seeking services. So you mentioned the directory. And I know you share a link in one of the later slides, I believe. That link was also put in the chat for everyone. So you can always scroll up and see if that is included in your notes. So.
Well, and we are also, there are folks that take the training and then just, forget to take that next step to submit their name to the directory. So we're doing a lot of outreach to folks who've completed NTI, to encouraging them to sign up for the directory and expressing to them kind of the value in doing so. And specifically, it's for families and that families are able to easily find providers when they're needed.
Wonderful. Now, can you share again just the training that you mentioned that was school specific?
Oh, school, but yes, I will share the link to the NTI page and then you can click on, so there's the 3 curriculums, actually 4. So child welfare professionals, child welfare supervisors, mental health professionals in school. So anyone who's interested can just enroll in whichever curriculum they'd like to. And I will pull that link.
That's perfect. That was one of those next questions on sharing that NTI link. So that is perfect. Are you able to just briefly, kind of off the top of your head, include like what topics are included in that adoption competent therapy? Like, is there anything that is specific to our kids that they could best benefit from, or things like, maybe this is just off base, it's not, maybe this isn't the right service for y'all?
And this is topics within NTI, right?
Yes.
Okay. Yes, and I can actually, there's like a one pager that has all of the modules listed. What we have found, NTI has been around since 2014 was when it was first funded. And the results of the pre and post test continue to show that attachment, the module on attachment, continues to be some of the lowest scores of the pre-test and the greatest improvement in the post test. So I would say that's one that really stands out to us because it continues to kind of, and we're talking about people that have maybe 15 years experience and still, there's things that they need to learn, which is great. That's why this training is free and widely available. So I will make sure, Margarita, to send kind of a resource that lists all the different modules for folks.
That would be great. Thank you. And is taking the NTI training all that is required to gain that certification for a therapist to say that they are an adoption competent therapist? Or are there other requirements?
Yeah, so it's not a certification, but it is all you have to do is take NTI or TAC and you can be in the directory, which then means that families can find you, but also that other colleagues can refer to you and be aware that you are someone who can really help our kids and families.
Wonderful. And I don't know if you may have any advice on this or, maybe some direction. Someone mentioned an additional challenge is that although, a provider could be adoption competent, maybe they don't work well with the Medicaid. Any advice
Mm-hmm.
that you can offer?
Mm-hmm. Yeah, so we know this to be true, right? And I think some of it, not always. I mean, it's very complex. There's a lot of reasons why folks maybe choose to not accept Medicaid, but I would suspect that a lot of it is based on the rate, the reimbursement rate. And that is why we bring insurance companies and Medicaid and managed care companies to the table to talk about specialized rates or incentives for providers to not only accept Medicaid, but to also invest in adoption competence. So when we say that we're working to increase access, it is a lot of different ways that you kind of have to keep coming at it from every different direction to try to make a dent.
Wonderful. Thanks so much. So again, we will send out some additional links and resources for y'all, so you can keep a lookout for those in addition to the slides. It looks like we're a little ahead of schedule, so as we're wrapping up, let's take a moment just to connect the dots and focus on what this means for you in your work moving forward. So can we get those slides back up, Casey? So our key takeaways from today. First, recruiting families is just the beginning. Retention and stability depend on our ongoing support, and mental health is such a critical part of that equation. Now, second, adoption competent mental health services aren't optional, they're essential. And when families know they'll have access to these supports, they're more confident in saying yes and staying committed. And finally, diligent recruitment and mental health planning should work hand in hand, because when these efforts are aligned, we create systems that truly sustain families and youth. Next slide. So what can you do moving forward? Start by embedding mental health into your recruitment messaging. Let families know you won't be doing this alone. That reassurance changes the conversation. And next, map your services and identify what adoption competent supports exist and where those gaps are. This helps you plan and communicate with confidence. Then integrate your adoption competence into training. Include those topics of trauma, grief and loss, and attachment content in your pre-service and ongoing training for caregivers and for your staff. Also use your data. Look at those disruptions, look at the wait lists, and youth needs to refine your recruitment and your retention strategies. And finally, ensure access. Make sure kinship caregivers and those families residing in rural communities have access to adoption competent services through telehealth and through tailored supports. Next slide. How we can help you. Now, remember, you don't have to do this alone. Both the National Center for Diligent Recruitment and the National Center for Adoption Competent Mental Health Services are here to support you. We provide intensive technical assistance to states, tribes, and territories. That includes helping you align diligent recruitment plans with service access expectations and integrate systemic efforts for adoption competence into your overall strategies. So visit our websites, explore our research hubs, and reach out for support. We can work alongside you to build stronger systems for families and youth. Next slide. In addition to the resources provided for y'all, please don't forget to sign up for our peer meetings if you haven't already done so. These are great opportunities for you to join peers from all over the country and share ideas or find ways to collaborate. So our next peer meeting is scheduled for March 11th, 2026 at 1 p.m. Eastern Standard Time. Next slide. So as we wrap up, just a final reminder, please complete our evaluation survey about this webinar. We would love to hear your feedback. Share ideas with your colleagues to keep the momentum going. And as always, please let us know how we can assist you. Thank you all so much for joining us today. Thank you, Erin, for taking the time to share your knowledge and resources. And we will see you all next time. Have a great day.